we get per day. And our cases include cases we get from other healthcare facilities for people that live in our area. So for instance, we have healthcare facilities like Hopi Healthcare Center, Sage Memorial. Some of the people that live in our service area go to those facilities. So anytime people test positive in those areas, they send it to us. So these are our total cases for our reservation areas that Winslow covers, as well as our border town areas that we cover, which includes our beneficiaries. And that is all for my section. Thank you.
Thank you, Denise, for your valuable information. And thank you for all your hard work that you and Lisha do for us. We appreciate you. Now we're going to move on to our next presenter. I believe it's going to be Sasha. She'll be covering the Coconino County data presentation. Go ahead, Sasha.
Okay, hi everybody. So I'm going to go ahead and just go over not just the Coconino County, but I'm going to start off with the Navajo Nation current data that can also be found on the Navajo Nation Division of Health website. And so just wanted to present real quickly so that you're aware of the numbers that we're looking at as of February 7th. And just to highlight the Winslow area on Navajo Nation, there was a total of 1,846 cases as of February 7th. And just wanted to show how the waves look. We are in the second wave, which has been explained before, that the United States went through 3 waves and Navajo Nation only went through 2 waves. And so you see that the large second wave has come down, which we want to continue to see that. And here is a picture that you may see in other sources, but just wanted to share with you. And Winslow service area is in the red section at the bottom left corner. And then by age group, and especially since we're really focusing on the school age with these school town hall meetings to see and just be aware of how the numbers look among our younger population. So we have here that we've had these age groups here. You see that the highest age is, or the highest numbers, like Denise reported, were like the 24 to 35-year-olds. So among Navajo Nation, you see here that they break down the ages a little differently. And so the highest rates would be among the 30 to 39, followed by the 20 to 29 year olds. But we do see that there is still a high percentage of the 10 to 19-year-olds that have had COVID on Navajo Nation. And this is just a graph kind of similar to how we had ours by community in our 8 chapters of Winslow service area. So these are the communities in Navajo Nation, and you'll see Winslow is in the brown area. And with this, we see that the curve is not as steep, and that's a good thing, but we want to continue, we want to see that flatten and plateau, they call it. We want to see that flatten because that means that it's not a lot of increase. So now when we look at Arizona, which is the same information we see on the news every day, we see this is as of today, February 8th. We look at the total percent positivity is at 14%. There was a time when it was above 20%. So we're moving in the right direction, and we want to continue to do that. When we look at Coconino County, we do have a presenter who is going to present on Navajo County, but when we look at Coconino County, we see here that Coconino County is at 11.7% positivity with new cases reported today of 60. And they have a graph just showing their since March 14th of last year all the way to February, you can see the trends of the COVID-19 cases by week, and how lately this month we see the numbers coming down, and we want to see that trend. This is by the different areas on this graph, and you find this on the Coconino County dashboard. They update it often as well. And you see how the blue line represents the Flagstaff area, and a lot of our people do travel to Flagstaff for work and for different activities and shopping. So it's good to see how the spread looks in that area. And we see the trends coming down there, as well as the green line would represent the tribal communities, and we see that trending downward too. This is the total cases by day, and this was since January 25th to February 7th. It's kind of up and down still, but as of the last few days, it came down, but still within the past 2 weeks, it's still up and down. As high as 62 cases new per day, all the way to just 1 case new per day. So it varies. Again, with Coconino County, looking at the age breakdown, and the population we're focused on would be the youth. And we see that 20% of the cases that of COVID are the young age, less than 20 years old. So that concludes my report of the Navajo Nation and Coconino data.
Thank you, Sasha. Also, thank you to Navajo County for sharing their information with us. And we're going to move on to our next presenter. Our next presenter is from, actually, I'm sorry, that was Coconino County. Now we're moving on to Navajo County, which will be presented by Janelle Lin. She's the Director of Public Health Nursing. So Janelle.
Good evening. Can I get you guys to share the screen? Do I have share permissions? There we go.
Yes, you can share your information.
Okay. Can you guys see my screen?
Yes, it's coming
Okay.
up. There it is.
All right. So these are our current case counts as of this morning, as far as data that has been reported to us. We are at a total of 14,583 that's been tracked through Navajo County Public Health. 9,713 of those are non-reservation, non-tribal related cases. Navajo Nation reports to us on Wednesdays. So our data for them is current as of Wednesday, that we had 4,157 cases, Navajo Nation cases that resided in Navajo County. We're seeing a downward trend over the last several weeks. We only had 22 new cases reported to us yesterday. 12 cases reported to us yesterday. 10 of those were confirmed and 2 probable cases. So our school benchmarks as of January 17th is the latest data that's available. Our rate per 100,000 was 453 per 100,000, which puts us in substantial spread for our school benchmarks. And for the county as a whole, we're at 18.9% positivity rates, which is also puts us in the substantial school benchmarks. We're at 15.1% for COVID-like illness, which has us classed in the moderate category for our hospitalizations. So our rates per 100,000 by community that would impact your service unit. Our Winslow is at 349 per 100,000. That's a positivity rate of 16.3%. And the Joseph City Unified School District is at 458 per 100,000 with a 22.7% positivity rate. And Holbrook is at 397 per 100,000 with a 16% positivity rate. And these rates are based off of the zip codes that apply to those school districts. I wanted to share some of our vaccination rate comparisons with you. The graph, the gray, shows the state of Arizona and where we're at with state of Arizona. For Navajo County, we have administered off reservation 11,160 doses of vaccine. We haven't received up to date vaccination numbers from our tribal partners. 9,307 of those are first doses, and we've completed 1,874 second dose in our vaccine series for Navajo County off tribal lands. So that's our data presentation for this evening. I also wanted to share with you as far as how surveillance and information sharing goes for Navajo County with Navajo Nation. We participate in the epicenter weekly calls on Wednesdays. Our nurse liaison is Mariah Walker, and she provides update for non-tribal data and information on those calls, and then they share information with us as well. And then that filters down through the respective communities from the epicenter to the different Indian health sites and information to the different chapter houses is how our flow of information goes with Navajo Nation.
Thank you, Janelle, for your awesome presentation and also your very valuable, important information that you shared with us. And thank you for all the hard work that you guys do over there as well. We appreciate you. Thank you for taking time to join us this evening. And now we're going to move on. You're done, right, Janelle?
I am. Thank you. And we
also
appreciate it with you.
Thank you. Have a good evening.
You too.
Next, we move on to our next presenter. She will be presenting on the COVID-19 virus and vaccine update. This is Dr. Farida Saifi with the Infection and Control.
Can you hear me?
Yes, we can. Yes, we can.
Okay. Just I want to share my slides with you if you see it. Can you see my slides?
Yes, we can. We can see it.
Okay. Okay. Anyway, I would like to thank everyone for joining the infection prevention session. In this time, we will discuss how to stop spreading COVID-19. We will discuss the important role of the hand hygiene, masking and social distancing in preventing COVID-19. Also, there are some questions about the MISC and also about the vaccination. I will try to cover all these areas in this short time which they give it to me. So in general, about the background, I grabbed this part because sometimes when I'm walking in the hospital, sometimes community members asking questions. For instance, I'm talking with them about the hand hygiene or how to keep the social distancing. And I heard this thing that they are thinking that COVID-19 is totally something new and they're afraid a lot. And I can say that COVID virus are a large family of viruses that are common in people. And also we can see it in different animals. And this is rarely happened that animal COVID-19 virus can infect people and then spread between people, such as MERS, like Middle Eastern Respiratory Syndrome that we, a couple of years ago, we heard about that, and SARS-CoV, and now COVID-19, new something that we are facing to this pandemic because of that. So the most important thing from the infection control standpoint is that to know that how it spread. Generally, COVID-19, spread from person to person, transmitted via respiratory droplets, particularly if someone do not cover cough, sneeze, or during the talking, if someone without masking, talking with others, or if people don't consider social distancing. Also, COVID-19 can survive on surfaces from hours to days. That's why it's important to keep clean the surfaces. On the other hand, one thing else that we have many people that they are infected, but they haven't any sign or symptom, but they easily can spread the infections. All these, somehow they are the way or the, the via surfaces, maybe someone infects someone, maybe via droplet. We will discuss more in this presentation about that. So there is a question from the families, from parents about the COVID-19 cases among children. I can say that we see more cases among adults, but most children with COVID-19 also have symptoms that they are mild, or maybe some of them haven't any symptom, like asymptomatic. However, some children may get, they may become severely sick, and they may need hospitalization, particularly in children that their age is under 1. So other questions, that among the questions that I reviewed, that what is multi-system inflammatory syndrome, or MISC? I can easily say that it's appeared to be a delay reaction that occurs in small numbers of children with COVID-19. It means we can see this specifically in children. Let's see that how it looks like. MISC can cause inflammation in different organs, like, for instance, maybe in brain, maybe inflammation in kidney, skin, lung, heart, or in our gastrointestinal organs. So here are the pictures that you can see it, that children looks like this, that they have fever, abdominal pain, vomiting, red eyes, some of them like diarrhea, vomiting, all these stuff. You can see it, like in this picture, you can see their tongues look like strawberry, like red tongue with spots, red eyes, all these like fever. I don't want to more focus on this just for general information, but my point will be mainly on the prevention side, how we can prevent the infection. So the most important thing for families, particularly for mothers, is that to know that how to monitor their children's sign or symptom. So I encourage parents to have thermometers in their home, and make sure that they properly utilize it, and to make sure that they take the temperature and write it at the time on a note or something. That helps their children. Later they can share this information with the provider if need. So other thing is clean.